All right, good morning, everyone. Welcome to our press briefing for the ongoing COVID-19 situation. I'm Carrie Schutte from the Health and Human Services Agency, and I will start by, let's start by introducing our hospital partners, and if you all have any updates from the weekend. Let's start with Shasta Regional.
Hi there, my name is Mark Mitchelson. I'm the Chief Nursing Officer for Shasta Regional. Really doing a lot of the same things with continuing to ensure we have screenings going on vigorously with patients and our employees. One thing that we are looking to potentially do and add this week is to start screening employees as they come into work, just making sure we have an extra layer of safety for our staff. And also I want to kind of reintroduce what we said on Friday, is that the Shasta Medical Group will actually be doing virtual visits online. So only for existing patients at this time, but we're looking to see how we can really expand that as well.
Excellent, thank you. Mercy Medical Center.
Good morning, I'm Robert Folden. I'm the Chief Operating Officer here at Mercy Medical Center. So we continue with our visitor restrictions. We've also limited access to the building to 2 basic entrances. So as Mark mentioned, we too have been screening employees for certainly about the last week. Surgeries, we've curtailed many of the less urgent surgeries. So again, that was part of the plan, was to, if you could move your surgical procedure out, we've asked folks to do that. And then this week is really about testing those surge plans that we've kind of talked to date. So there's a group of people right now that are down in our boardroom poking holes at all of our plans to either move patients or, the what happens if. So I think we're feeling as confident as one could feel at this point.
Okay, thank you. And Val from Mayors.
Good morning, I'm Valerie Lakey from Mayors Memorial Hospital District in Fall River Mills. And we too have just been following the same stuff we have been for a while. We have been not allowing visitors since March the 6th, and we've been screening our employees for about 2 weeks now, and just trying to keep up on all the new guidelines that come out so that we make sure that we're following everything accurately. A lot of collaboration with the 2 readying facilities in testing our surge plan and figuring out what we would do if need be. And then most recently, we have taken some extra precautions in our skilled nursing facility. So we have eliminated all of the communal activities that happen in our skilled nursing facility and have been trying to come up with some alternatives. We've been doing like Zoom meetings for the families to be able to contact their loved ones, as well as some email and e-cards and those kinds of things. But our biggest priority is to keep those skilled nursing residents safe.
All right, thank you. And Karen or Dr. Ramstrom or Brandy, which of you would like to go first?
I'm sure you can go.
Okay.
Sure. So today we wanted to let everybody know about 2 cases that came up over the weekend. One of the first to bring us to a total of 5 cases in Shasta County. The first was late in the day on Friday. We heard of a patient who's been hospitalized in a hospital in Sacramento County and for other health issues, and later in that hospitalization was tested for COVID-19. And so it's a Shasta County resident, but was identified outside of our area. And then the second was yesterday afternoon. A gentleman in his 80s who's hospitalized here in Redding tested positive for COVID-19. And I think I don't necessarily have any other updates other than just the normal reminder that this is probably just the beginning. And so I think this really reinforces why it's so important for all of us to heed the governor's stay-at-home order and to limit our interaction with other people and our amount of time that we're out and about, just meeting our basic needs, such as at the grocery store, washing our hands frequently, and avoiding contact with people who are ill. it's going to become more and more important for us to do that as we're seeing these cases rise. The goal is to do more of that social distancing so that we can push out the peak in our number of cases here in the county, so that our healthcare providers and hospital system will be able to meet that need.
All right, thank you, Dr. Ramstrom. Brandy, do you have anything to add this morning before we take questions?
I think I would just like to clarify, well, I don't even know if it's clarifying, but add to what Dr. Ramstrom said and really emphasize not just staying at home within Shasta County, but people leaving Shasta County and going to areas with kind of more well-documented widespread community transmission of COVID-19 is definitely not advisable. So areas like Sacramento County or the Bay Area, obviously some folks need to go to those areas for medical appointments, and we're not trying to give advice that way, but please avoid traveling unnecessarily to those areas and coming back. And then we've also heard about some situations where people have had relatives visiting from areas with a higher degree of widespread community transmission. And if you could also really limit that to only absolutely necessary visits, we would really appreciate it, and it will help protect our communities most vulnerable.
All right, thank you, Brandy. I also wanted to give all of you the update on the numbers before we dive into questions. So right now we have in Shasta County positive cases, 224 negative cases. That is 134 from our public health lab and then 90 from commercial labs. We have 3 people on isolation. We've got the one at home who was our third patient. We've got, our third patient. One at a Sacramento County hospital, and then the one that Dr. Ramstrom mentioned just a few minutes ago, who is at a local hospital. And then we have 15 people under health officer quarantine orders. And at this point, we will open up to media questions.
Well, I'll jump in. Good morning. Maybe for Dr. Ramstrom or Brandy, are there any updates on the field hospital?
So I can go ahead and make a comment about that we are still in negotiations with the state and the federal government about what type of asset is needed in Shasta County versus other parts of the North State. And so our HHSA director, Donnell Ewert, is taking the lead on those negotiations and trying to make the best decision for our county by making sure that the entire North State is covered with federal assets.
I have a question.
Okay, go ahead, Donnie.
Hi. There's words circulating through the community, both on social media and kind of anecdotally from people who work in the hospitals, that some staff at the hospitals, I'm speaking regarding the 2 Reading hospitals, do not feel adequately protected, and that they're being asked to vary from their usual previous safety practices. So my question is how is it going as far as adequate PPE for all staff? And if there are shortages, what measures are in place to compensate for the lack of the protective equipment needed?
If it's okay, I'll kick that one off, Donnie. So sure. I know here at Mercy Reading, first, let me start with, I think we feel as confident as we can feel in having PPE available, not only for our run rate, but kind of the run rate that other hospitals within our system have seen as they get more of these patients inside their walls. So the second piece of that kind of goes back to staff concern, and I think your question was deviating from practice, but we haven't asked our staff to deviate from practice. I think where some of the confusion might come from is when the change was made to treat this like a contact isolation, right? So that just caused concern because people see what's happening throughout the world, and of course, I think they want to go right to the extreme measure rather than kind of relying on the science that we know for processes that we participate in. And certainly those processes that cause aerolization, like respiratory treatments, or if I'm an anesthesiologist and I'm intubating a patient, clearly we'd want to use the higher level of protection there. And then the last point I guess I'll make is that being part of a large system affords us the ability to look outside of normal channels. So every lead that comes to us for PPE, whether it's, you know, a box here or a case there, or, you know, 5 million masks somewhere, we have a team working 24/7 within Common Spirit Health that is investigating those leads and seeing how we can get additional PPE here. So while we're fine now, I think the bigger unknown for all of us is, what does it look like if we were to have an actual surge? And then your turn rate or your churn rate of PPE changes. So again, that's some of the work that we're literally doing right now down in our boardroom. And we're using models that have been prepared not only by the CDC, but the California Hospital Association as well. I'll turn it over to Mark.
Thank you.
Thank you. So every day we're checking our supply levels, making sure we have an adequate supply in any of the contingency plans that we have, just in case there is a surge of patients in our facility. One of the things that you may have seen on social media is that concern over a changing of precautions, you know, and with us being so tightly wound with the public health and CDC, you know, there have been changes in the recommendations of protection. At first it was everybody wear an N95 and do that airborne isolation, but CDC has changed to what's called an enhanced droplet precaution, where a simple surgical mask and goggles is okay. We have early on, because we knew that there was going to be supply concerns, at least at our facility, we have switched to doing a lot of what's called PAPR utilization, which is a hood-like system that is actually a little bit more effective than the N95 masks. And we did that to make sure that we were okay in our supplies, but also to provide better protection to the patient and the staff members.
Hey, thank you, Mark. I think I said contact. Thank you for that correction.
Okay. You all have.
Yes, I have a question. Can you hear me?
Yes, we can, Steve.
Could address the protest that was done out there on the sidewalk on Friday by the nurses concerning the PPE?
Sure, and I think it was kind of similar to what I just said around their concerns of feeling not having a sufficient supply of PPE for themselves in the facility. And I do want to just make sure that everybody knows we do have a very sufficient supply of PPE. We just have to be very cautious in making sure that we utilize it correctly, because if the numbers of cases do increase and become like a New York City type of atmosphere, we want to make sure that we have tight control over them so everybody has an ability to have PPE. So we are being very cautious, making sure that everybody utilizes it correctly and not unnecessarily. But we do have a very good supply of PPE, and we can make sure that our staff are safe.
Thank you. I have a question for Dr. Ramstrom.
Okay.
What's the status of the testing supplies? Will we be able to do widespread testing here soon?
So unfortunately, the testing supply issue continues. And so even here in our public health lab, we are being very, very careful about who we're testing now, because there are certain supplies that we're not able to get to that actually allows us to extract the specimen for testing. We learned that we're not the only county in that situation. And so I have not heard that relief is in sight anytime soon. We're really looking forward to more tests that are FDA approved coming online and being available. There are some in the pipeline that we're going to be taking advantage of here in our community, but they are delayed. And it's quite frustrating for us, as it is for all of our community members who are interested and feel like they might have influenza-like illness symptoms and feel like that they would like to be tested. And unfortunately, we do not have the supplies, and it's a national issue, unfortunately. And it's not, only the test kits, but it's the specimen collection, tubes and swabs and all of those pieces that, as well as, we've even looked into making our viral transport media, and the ingredients are back ordered. And so we are looking into some solutions there using saline, which is approved to do instead. And so, but then you have all the other pieces and having to make sure that they're available. So it's quite frustrating, and we're continuing to do what we can to try and have a coordinated, pooling of resources locally and making it available, and communicating really closely with our hospitals and here in public health and with our outpatient providers. And it's still a problem. So that's kind of where we are.
The only thing I'd like to add is that one of the efforts that we did undertake late last week is to, at Dr. Ramstrom's request, is really started to survey our private outpatient clinics to find out what their barriers are to collecting specimens and sending out to private labs. Right now, the only limitation that we know of with private labs is that it's a long turnaround time, so it might not be helpful in the clinical decision-making process. But from a surveillance perspective, we certainly would like the private outpatient clinics to kind of give us information about what they might be willing to help out with in this arena.
Is it true that there are drive-through testing events going on in Sacramento area and other areas? And is that because they have adequate testing supplies because of the widespread community transmission there?
Yeah, we have heard that as well. And why they're able to do it, I don't know. We actually are in communication with one of the commercial labs to see if we could get some supplies to do something similar. And so those conversations are in the works. I've heard that some of the supplies for the commercial labs have been redirected to areas where there is more transmission, as you alluded to. I've heard that some, like Quest, for example, has told us they actually have no supplies to give. LabCorp and Quest, I've heard, are both kind of prioritizing some of these drive-through types of opportunities. And so we're hoping to move in that direction if they have the supplies available. So more to come on that.
I have a question regarding screening of staff. And so in the event that a staff person comes into work and they're screened at the door, and this question is probably for the hospitals, but I'll take the answer from anyone. But let's say someone comes into work and they're exhibiting some kinds of symptoms. And as I understand it, then they would be sent home to self-quarantine. And then how long after the symptoms subside are they allowed, before they're allowed to come back to work?
I can take that if that would be helpful. And so the recommendation, whether it's a person who's been confirmed to have COVID or they actually have influenza-like illness and haven't been tested, is based on the science that we know now about COVID-19 and the period of communicability, is for that individual to stay home for 7 days at least, until a period where they've been fever-free for 72 hours and symptoms are improving. So those three criteria together would indicate that individual would not be infectious any longer and would be able to return to their normal activities. Yeah.
Thank you.
I also wanted to point out, you probably noticed that Dean Germano has joined us from Shasta Community Health Center. So if you have any questions for him, there he is right there. What other questions do you all have for us?
Now that we're several weeks in, is there a better idea of what symptoms differentiate COVID-19 from the flu?
It's a good question. I think, as this continues to progress, we're going to learn a lot more and how this disease process looks in different populations. But right now, the main symptoms that we're looking for are fever, cough, shortness of breath. Those are the most concerning, but it's a wide range of symptoms. People often also have fatigue. generally not feeling well, kind of body aches, sore throat is not uncommon. So it's a combination of those symptoms that, from a clinical perspective, a physician or other kind of healthcare provider is going to be asking about all of those things and putting the pieces together and determining whether they have concern for COVID-19.
Forgive me if this has been addressed at previous meetings, and this is my first one, but what about the homeless population in terms of testing and screening and sheltering in place and all that stuff?
So there is a countywide group of individuals who are working on that specific issue, including our director, Donnell, our director of housing, Christy Coleman, and the Good News Rescue Mission, a variety of other community partners who have been working diligently on that specific issue. I'm not sure that we have anything to share quite yet about that, but please know that that is a high priority for us, and there are plans in the works to start to address some of those unique concerns that are experienced by that population.
This is Dean Germano. I can just share a little bit from our HOPE team, and we are routinely screening at our HOPE sites, and we've actually freed up some resources so our outreach team can go out into the some of the camps and do some preliminary assessments, and if necessary, do some testing. But testing, as we all know, is at a minimum. So really, we're just tracking symptoms and educating as much as possible about keeping distances. But as you can appreciate, it's pretty hard to do out there.
Right. Well, Dean, what happens if someone does show symptoms? Then what do you do with that person?
Well, I think it depends on how, a lot of our homeless, their health is already compromised, particularly the older ones and chronic diseases. So the few that we've had, I think we've worked with public health, I know we have, and brought them to one of the hospitals to be looked at. I think at least one I don't think they were sure. And then we ended up working together to isolate them in a place and just monitor their symptoms. I think that was the best we can do in that circumstance. So, but certainly if that gets into that population, it could be a real problem. So I appreciate the work of this group. They're really spending a lot of time and energy trying to figure this out.
Yeah, and I could just add too to what Dean said, is that we here at Public Health, even though we definitely have limited supplies, are prioritizing, certain groups. We are setting some of those tests aside here at Public Health for individuals who might have influenza-like illness in a congregate setting, and so that would include the homeless population, skilled nursing facilities and such, where we could actually get into trouble if that was to spread in those groups.
Questions?
I've got a question for the hospitals, I think, Robert and Mark. I understand, confirm, deny, whatever, that the field hospital would take patients who are less ill, while you in the hospitals could take care of the people who have more significant illness. How would that work?
With lots of coordination. So Mike, I think this is kind of an untested process in our community, right? And likely something that we could only do in the time of a crisis, or a crisis like this that's been declared. We've been in contact with Donnell. We participated, both hospitals participated in looking at potential sites. I think there's many things that have to be done before we can implement this. But in reality, if we were to get this big surge, right, we keep labeling it as the surge, we're going to want as many less critical patients to be outside of the hospital as possible. So, a facility like this might be just the thing we need to protect a somewhat vulnerable population that doesn't have this illness, and then allow us to focus our efforts on truly the most critical. And I think one of the things that both of us are doing are looking at kind of worst case scenarios in that if we had many patients on a ventilator, right? So now you're talking high risk interactions. We don't want your average hospital patient here during that time. We want to be able to devote resources to the most critical of patients.
Any other questions?
You brought up ventilators, Robert. I'm curious, do we know how many ventilators are available in the Reading area? And is it an adequate number?
Well, I can't speak to the whole area, but I know here at Mercy Reading, and I believe we did a little update last week from Shasta Regional as well. We feel like we can handle 70 or so patients on a ventilator. Now, there's many different types of ventilators. When we talk about a patient up in our critical care unit, clearly those are the advanced multifunctional type ventilators. We also have ventilators that we can use that come from the operating room. And then we have for lack of a better term, I'll call it a mass ventilator, which is sort of one control for many patients. So we have ways to sort of flex our capability. And I know Shasta Regional has very similar technologies.
Yeah, I would just echo that we have a significant amount of ventilators between both facilities. And when you compare the usage on a daily basis of what we do versus what we have available, I think we can definitely accommodate a fair amount of the surge if needed.
And Mike, these are the kind of things that we keep looking, if we can purchase more ventilators, we certainly want to do that. It's kind of like the previous question about PPE. We are not going to stop looking for PPE. Even if we felt like by the end of this week, let's say we thought we had plenty to get us through for the next month, I think we're going to continue to look at where are our sources. And part of that just goes back to, we may need to be a really good community partner. If Shasta Regional needed something that we had, well, clearly, we're going to work together. And that's part of the reason why we wanted to do this format, was to demonstrate that this isn't about Mercy Reading or mayors or SRMC or the county sort of going on about business as usual. This is about us working together as business as usual.
Yeah, and I just like to emphasize what Robert just said, because the public health role function in this particular situation is we do take resource requests from all of the different healthcare facilities and kind of pool them, and our staff work with Dr. Ramstrom to prioritize to make sure our community has enough supplies. And then we do look within our county and then our region if there is one particular partner that is short on supplies. And we've had such great experiences, both in this situation and in the past, with the hospitals or other healthcare providers being willing to contribute more so that they can be shared and distributed evenly throughout the county. And then there's a process for us to go to the region if we need more resources, and then a process to go to the state and the federal government through our Department Operations Center.
Do you have a round number estimate of the PPE that's been donated by the community?
Boy, as far as Mercy Reading goes, I don't have an actual count on hand. I will tell you this, that as people donate, we're tracking not only from a thank you standpoint, but from the standpoint that if we don't use that, our intention would be to potentially return it. But we've had a great outpouring from, you name it, Harbor Freight, SPI, dentist's office, doctor's offices, veterinarian offices, people who had masks from the car fire sitting in their garage. I mean, it's the typical Shasta County response to any emergency.
Yeah, I think I'd like to reiterate the county's thanks to all of those different businesses, but also local seamstresses that are stepping up and making mask covers and gowns and things like that. And so they're being donated kind of more anecdotally to various hospitals, but we actually had some donated to our department as well. And then we just put that into our cache of PPE, and then we resource it out accordingly.
I have a question regarding the logistics of visitors in a hospital. What happens in the event of, say, the maternity ward? Are doulas and midwives still allowed in? Is a mother allowed in to be with her daughter during labor? Is the father allowed to stay? And then also, what about pediatric patients? Do they have a parent stay in there like they normally would? And also people who might have developmental disabilities, things like that?
Yes. So when we have a mom come in to deliver, clearly they are allowed to have one visitor with them. Same thing for a pediatric patient. And then I'd take it a step further and say, you know, any patient that's in the hospital right now that requires a caregiver, and there are many circumstances where caregivers are part of that person's life, they're allowed in as well. But Donnie, I think that was you that asked that question. The
Right.
challenge for us is a challenge we're seeing across the entire nation, and that's limiting the amount of people that we are exposing our patients to, that we're exposing our staff to. So I know it's not comfortable when we place these visitor restrictions, but we're truly doing it from a public health best interest standpoint.
Sure. Thank you.
Any other questions this morning? Okay, so this week we're switching things up a little bit. We're going to be doing our live briefings like this on Wednesday and Friday. And then on Tuesday and Thursday, we'll just be posting a written update from all of our partners on our Facebook page, which they'll be sharing on their Facebook pages as well, unless something super significant comes up that we feel like we need to share before that time. So we will see all of you again in real life on Wednesday and virtually on Tuesday.
Thank you,
Thank
everybody.
you.
Thank you,
Thank
everybody.
you.
Have a good day.